Hey, it's Scott. And the other day I was driving to work and I heard a podcast. And they were describing a new way to remember something. And all I kept thinking is, oh my gosh, this is actually really cool. And the focus of the podcast was when it comes to babies, don't get scammed. Now, normally when you hear scammed, we think things like credit card scams, would you like a new mortgage scams, Medicare scams. However, specifically what they were describing is in the event that you've got a little one, meaning a baby, meaning under a month or so old, who presents looking sick as a dog, they're like, don't get scammed. That means SCAM, as a way to remember the icky things that could be going on with this baby. So first, before you jump into scam, everything bad that happens in little ones is respiratory. And if it's not respiratory, it's probably respiratory. So with that disclaimer rendered, specifically beyond just respiratory, SCAM. During the first month of life in your ER, S is sepsis. Because every baby during the first couple of weeks of life is septic. And if they're not septic, it's because they're thinking about becoming septic. So S is sepsis. C is cardiac. Meaning, do they have some sort of a funky, flipped upside down and backwards heart disease, cardiac defect that's making them look sick? S, sepsis. C, cardiac. A, abuse. Otherwise known as non-accidental trauma. M is metabolic. Metabolic means you have hyper XYZ-ism. You have hypo PDQ-ism. Otherwise, chances are something most of us has never heard of. But if it's really something funky with what they describe as inborn errors of metabolism, otherwise known as something metabolic, that is M. And again, coming back to S. Sepsis, cardiac, abuse, metabolic. The last S, just as a reminder, sepsis, followed by seizures, followed by sugar. Because when you've got a sick little kid, remember before they go away, if they're anything but cute, A, B, C, but more importantly, D, E, F, G, don't ever forget glucose. So in the event you've got a sick little one, especially under 1 month of age, and they are presenting looking sick as a dog, never get scammed. SCAMS.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best: under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next PEDS patient could be your worst PEDS patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.